Hi, I'm Dav from Concentric Health. This short video is a demonstration of the Concentric Digital Consent application for clinician users. To start, simply go to Concentric in your browser and log in. This can be done from any device, including your personal devices. I'm using a demonstration version of the application, so no real patient data is shown. From the home page, you can search for a patient and see recent consent episodes. Let's search for a patient. Here we see any previous consent episodes for this patient. To start a new episode, click the big plus button. I can search across the concentric ontology across over 1,000 procedures, including using acronyms to find the right procedure quickly. In the clinician view, I can select the information that is relevant to the patient, supported by suggestions by the concentric ontology. This includes indications, alternatives, anaesthetic options, risk profile, and additional patient information. Each field can easily be made bespoke for the individual, for example, adding a bespoke risk, as shown. We work with clinicians from each healthcare organisation to ensure that the information is appropriate for the local context. At this point, the information is ready to be shared with your patient in the consult view. Consult view facilitates a consent consultation between you and your patient. Lay language is used to describe terms, and trusted sources of additional information are shared. Information regarding indications, purposes, and alternative options are shared on this first page. For many patients, their anaesthetic plan is an area of uncertainty. On this page, we can share at a high level what the plan will be and signpost the sources of information, such as this video about having a general anaesthetic. Whilst on a paper consent form, the risks of surgery are often a long list of medical terms. With Concentric, we can support patients to reflect on each potential complication, including when they may occur, how likely it is to happen, and what it might mean for them. Where a particular conversation has been had around a risk, notes can be added to document the conversation. Additional information can be shared with patients and may include information from national bodies, patient videos, and information about attending your healthcare facilities. Depending on the individual circumstance, you may wish to simply share the information with your patient, allow them to sign their consent later, having considered the information, or sign with you in your clinic or on the ward. Concentric facilitates all these options. I'll show the remote consent options in a moment. For now, let's proceed to give consent. Here the patient is asked to confirm that they understand what is being proposed and can be asked regarding any additional consent, such as for a blood transfusion in this example. The patient can then sign on the device, or if easier, can transfer to another touchscreen device via a secure code. So that patients can access their information, their email is added. Where an email is not available, patients can receive a printout of their bespoke information. When consent has been given, the key information is presented as a summary and can be used initially to confirm consent and then during a surgical safety check in theatre. The completed consent form can be automatically sent to the patient's record in the organisation's electronic health record. There are scenarios where remote consent is beneficial, both allowing patients time to consider their information and reducing the need for physical outpatient appointments. To enable remote consent after a physical consultation, simply state that the patient is not ready to consent yet and enable remote consent here. Remote consent can also be enabled by clicking the action button in clinician view, for example, following a video consultation. The patient then receives an email and enter their date of birth to access their information. This contains the information shared, including recommended resources and consultation notes. Where remote consent has been enabled, this can be completed and is then visible within the clinician's application. If you have any queries regarding any of the functionality, would like to know more, or have any feedback for us, we'd love to hear from you.